Welcome everybody to SexRurality. I love working in this sector. You're all my sort of people. You know, I do a lot of sexual health and I've done it for actually quite a few years. I went away from it and came back to it and gee, I'm glad I'm back. Here we are. This is VACCHO. We're based in Collingwood in Melbourne, but I tell you what, I'm very rarely there. I do a lot of travelling around and I have done heaps and heaps of travelling. But before I go any further, I just want to acknowledge that today we meet together on Aboriginal land. And when I travel around Victoria, I am just in awe and in honour of the elders in Victoria, the sweat, grit and determination that established all those ACCHOs in Victoria. Amazing. And I feel very honoured I want to acknowledge all the elders in the room, all the Aboriginal people in the room. Thank you for welcoming me as well. And I want to pay my respects to all those that are coming forward as well, those in the past, now and in the future. It always was and always will be Aboriginal land in my book. There's VACCHO and we've got membership. So maybe people don't understand that VACCHO is actually, our membership is all those ACCHOs, all those Aboriginal controlled health organisations, and they have boards, and our VACCHO board is actually governed by those Aboriginal community controlled health organisations. And my core business is to support our membership. So what do we do? I sort of do a range of different things. Statewide advocacy, I support systems change around using data, sexual health, BBV training and resource development. It's some of the stuff that we do. By the way, I've also invited Peter Wapples-Crowe up. We didn't introduce Pete, but Pete, we also work with Pete. He works for Thorn Harbour Health, so apologies, Pete, that we didn't introduce you at the beginning. So understanding the context, put your hand up if you've ever been to an ACCHO. Great. Awesome. Put your hand up if you've done cultural safety training. Okay, great. The context in working in ACCHOs, I'll just do a brief little thing about that. Sometimes it's like if you're working in an ACCHO, you've got a lot of different, and we've got a whole lot of people here from ACCHOs today, but it's just like a tsunami wave coming at you. Oops, I'll go back. So it's like thousands of things people have to do, and sexual health is just one of that. We've got chronic kidney disease, we've got all the other diseases, cancers, all sorts of things. So it's a huge thing. I'm just going to whiz through my epi slides. The top slide is Aboriginal populations in Australia. It's higher for chlamydia. It's higher for gonorrhea. There's a syphilis map of Australia. What happened with syphilis? It started in Queensland. I think you're probably all over this. They withdrew sexual health workforce in Australia. In Queensland, it shifted to the Territory, it became endemic there, and it shifted around and it's moved to us. Syphilis is higher in Aboriginal Victorians. Other bloodborne viruses, same deal. In my book, this is unacceptable that we're having this level, this burden of disease in Aboriginal communities, and I'm passionate to do what I can and support other people to reduce this. This is not okay. And it's nothing to do with sex, by the way. There's HPV, another one. So take-home messages. I can't read all that. Gonorrhea is rising rapidly. Increased gonorrhea in heterosexuals. We've had this. Syphilis is rising rapidly. Congenital syphilis has re-emerged. Chlamydia is high. Hepatitis B and C still remain high. And also there's quite a bit of underreporting in Aboriginal communities as well. Does anyone know why there'd be a bit of underreporting?
Institutional trauma?
Institutional trauma, maybe. Stigma.
Nowhere to report to?
Nowhere to report to. Yep. Stigma and discrimination, the usual suspects. Universal screening is the key. I think one of the keys. Because we don't want to point that finger and look at you and say, you're that sort of person that needs an STR check, or you're that sort of person that needs an STR check. We need to normalise the question. But before we do that, we need to know who's Aboriginal or Torres Strait Islander. Why? Why do we ask that question? Helps you gather accurate information. Any other reason why you do it? Yeah. Improve their health status. Yeah. So some of the work I do in advocacy is actually talking to people who may not be their core business and working with Aboriginal people, why you ask the question. There's a link for you. But I think one of the ones is respect. And I talked to a worker who was working in another part and she said, I thought if I asked them the question, it was like, I get that all the time. I'm from Southeast Asia, and if I ask the question, it means I'm being really disrespectful. It means that I'm actually doing something like, people ask me all the time where I came from. Actually, the Aboriginal and Torres Strait Islander people, it's actually about respect. It's about culture that's safe and protective. It's actually knowing what's around to help people. ACCHOs can have a whole lot of wraparound services they can use. Transport, a whole SEWB, a whole lot of other things. So in terms of screening, there's guidelines, I've just put them there, and the guidelines say for young people between 16 and 29, you should have at least one STI check a year. So we need to screen. And I want systems change and I want it now. Oh, let's go for it. Actually, this is a reality. I'm more like the tortoise. We're plugging away at it. So what are key system challenges? ACCHOs are under-resourced. Guess how many EFT there is for sexual health, dedicated sexual health workforce funded in Victoria by the Victorian government? How many positions do you reckon? How much EFT? Give us a guess. 0? No, there's more than that. 1 EFT at VARS. That's one dedicated sexual health position in Victoria. My position is a national NACCHO position. So that makes 2. And the one at VARS is basically Melbourne-based. Mine's a state position. There's no sexual health workforce, right? I can't read that. Workforce turnover is high. It's very hard sometimes. People move around and we need to build a skilled workforce. So that's a really important thing. Anyway, generic services do not understand often how ACCHOs work. So if there's not one of the take-home messages, connect up with your local ACCHO, make a relationship with them and listen is number 1. So what does VACCHO systems approach? We have a key focus on prevention. So we have these new positions called prevention and early intervention, positions to actually get before the diagnosis, let's prevent stuff, and sexual health is a core component of that. We want to embed system change within ACCHOs. We do lots of train the trainer, and we use program logic to develop a whole lot of different programs. We also do some sexy health webinars. Sexy Health Matters. So our data-driven change is to do with training of clinical and non-clinical staff, CQI training. So we've got a big CQI focus. So learning how to do PDSAs and embedding that into your practice. We do those webinars, we do dashboards, so we give people their data, people share their data and we give their data back. So they have dashboards to look at how they're going so they can monitor their progress and also compare themselves with the state. We've got this new Power BI tool that's going to revolutionise that as well and make it much easier for ACCHOs to generate their own data. We do business modelling and look at their MBS. Does anyone know Janina De Silva? She couldn't be here today, but she's managing the Working Together for Health PEIC positions. And so I work very closely with her when we do business modelling to make sure that people actually get the right, generate as much Medicare revenue, and also look at nurse-led clinics, trying to look at how they can, how we can actually assist ACCHOs to generate the best bang for their buck. And also we're looking at flows, client flows. We do Medicare walkthroughs and a whole lot of other stuff which I won't bore you with. So client flows, Medicare walkthroughs. And we're also now generating local action plans, STI and BBV action plans. So that's we also have our STI campaign, which is we have a webinar, podcast called Yarn and Health on iTunes as well. We do Deadly Sexy Health Kit training, which is a kit designed for Aboriginal communities, and so it's a train the trainer model, so I do that training. And a word from Mr. Condo Man, sexual health is everybody's business. Young Deadly Free, if you've never looked at that, it's a fantastic website that James Ward from Shamri has put together. It's got a whole lot of resources, including Condo Man videos. So if you're working in this area with Aboriginal young people or with anyone really, I think they're fantastic videos. So in terms of the tsunami, I really like this. That's what we're doing. We're surfing that tsunami. And there's so much amazing work that ACCHOs are doing. Despite all those challenges, I find it incredible to watch the passion and determination that all our colleagues are doing and making a difference in the sexual health space. So I'm going to ask any questions. Great. I think I might move over. Thank you. There's my details.
Thanks, everyone. Thanks, Anne. Great. I'd also like to start by acknowledging the traditional owners of the land on which we're meeting today and pay my respects to the Djadja Wurrung elders, past, present and emerging. My name's Tara. I'm a Tanarong woman, but grew up and living on Wurundjeri land in Melbourne. I'm a public health registrar working at the Burnett and spending some wonderful time at VACCHO with this awesome team. Today I just wanted to chat a bit about adolescent health and wellbeing, with a bit of a focus today on thinking about accessible primary health care for young people. The journey through adolescence is an exciting and significant period in our life, but it's also an important time of growth and development. There's physical changes, emotional changes, and also important social transitions as young people move from education into the workforce and also starting to form their own families. So when thinking about health and wellbeing of young people, it's important that we build on the existing strengths of young people, including connections to culture, to family and to community. But we also need to recognise that some of the challenges that are facing our young people. And as we know, sexual health and reproductive health is one of those areas. So sexual health is an important health issue among young people, as we heard this morning through the great presentations. But there are lots of other important health needs among these young people. And these include other communicable diseases, non-communicable illnesses, and also injuries. So I guess this highlights the real need for holistic healthcare and the wraparound services which Anne mentioned earlier. It's during adolescence that the inequity in mortality between Aboriginal and non-Indigenous young people arises. And this graph also shows, which is most striking, is that most of this mortality is preventable. So things we can do about this right now. So with this in mind, there are many models of care and wonderful different avenues that we can support the health and wellbeing of young people. These can include schools, sports, outreach models, youth centres, and lots of programs centred around cultural community elders as well. And primary healthcare is the critical component as it provides this holistic healthcare and it's also funded, which is really important through Medicare. This is one image that how we've been kind of thinking about accessible primary healthcare for young people. So, on one side you have the health service, and on the other side is the young people. And young people often have a very difficult path to get to health services, and this is due to barriers that can occur on either side. So barriers that can occur on the health service side are things like cost, opening hours, and the types of services provided. Barriers can also occur on the side of young people, and this may be knowledge about services, it can be fear, shame, it can be health literacy as well. However, these barriers are poorly understood in the literature, and particularly among Aboriginal young people. So given this, a systematic review is underway and to help identify some of these. And some emerging findings that have been found so far are that the importance of friendly and non-judgmental staff that have really good communication skills. And these findings are common across all young people. However, the importance of gender-matched Aboriginal staff also has been highlighted in one study, and also that shame, as we know, can be a barrier to accessing healthcare. So to understand these better, there are a number of ways or approaches we can explore these with young people to ensure that we're bringing the voice of young people to the centre. These can include focus group discussions, interviews, surveys and anonymous client feedback. And these are some of the approaches that will be explored for an upcoming project in Queensland with the Puna Pima and SAMRI. So as I mentioned, focus group discussions are one way to bring the voice of young people to the centre. And there's lots of participatory methods that can be used. Body mapping, priority ranking activities, and community mapping can also be explored to help start the conversation, create a safe space. And there's other really important other avenues that can be explored using culture, which Pete's been doing a lot of work around. So why is the voice of young people so important? So there was a study done in Queensland that asked health staff about what some of the barriers may be for young people accessing sexual health services or sexual health care. This was in a range of settings, including primary health care. And health staff identified confidentiality, awareness of services, transport and opening hours as some of the main important barriers. However, when they spoke to young people, these factors were also highlighted by the young people. However, what they described as most important were having warm and friendly staff that were easy to talk to. So this highlights that we need to understand the priorities and preferences of young people. And to finish up, so adolescence is an important period of growth and development with broad health needs. Our young people are incredibly strong, they're knowledgeable, resilient, and we need to bring their voice to the centre of all our work. Thank you.
Ngā tau everyone, my name is Belinda Payne. I'm a second generation Yorta Yorta woman, stolen generation. My talk today is on leading on from Anne and Tara about the Prevention Early Intervention Coordination. It's a new role that's sponsored through VACCHO in the department. There are 3 PEI positions. Jenny over here is at Rumballara, and there's also a position at Watherong in Geelong. My position is hosted at Gunditjmara, which is in Warrnambool in the southwest of Victoria, but the position is a coordination position across the 4 ACCHOs. So they're my 2 nieces, Trophilia and Shai, and they're sitting at the mouth of the Hopkins River at Moyjul. So it's really important that all the work I do is from a strength base. We're very focused on not focusing on negatives. So if you look at, it's my Auntie Bev, even though she's the same age as me, but we call her Auntie. So the aims of the role, I'll talk through, and I'll talk through who the Aboriginal controlled organisations are that I work across. Talk about the stakeholders, what's happening in sexual health and cancer screening, what we're doing, how we're using culture and connection and incentives, and what and where next. So that is the Hopkins River. That's just down the road from Warrnambool at Framlingham Mission. So the aims of the Prevention and Early Intervention Coordinator role is to increase health assessments across the 4 ACCHOs, to get to a sustainable financial Medicare model. We want to be self-determined. We don't want to rely on grants that go for a year or 6 months or $10,000 here and $10,000 there. A lot of the time in ACCHOs is spent acquitting grants and applying for grants to try to keep things moving. We want to increase cancer screening. We want to increase referrals, establish pathways for identification for eligibility clients, improve documentation in the client record. The ACCHOs across the state use different software models. So we have 4 software models, of which I'm sure you're familiar with quite a few of them, best practice, Communicare, medical director, etc.
but we also use a tool through VACCHO called PenCat, which I'm sure a lot of you are familiar as well, to extract data from. We want to increase utilisation of MBS items, same as what any GP practice wants to do, because we want to actually make money to invest back into the community. And increase the uptake of HPV immunisations, which I'll talk more about today, and improve early detection of Hep B, Hep C and STIs. First, I wanted to talk about the 4 ACCHOs. I think it's really important that I acknowledge them today because the work is being done in the ACCHOs. My role is one of coordination, so it's to help people do the work, but I'm not actually doing the work in the ACCHOs. These people are on the ground. So Purnham is 20 k's from Warrnambool. It was established in the late 70s. It's to assist the physical, mental and emotional needs of the Framlingham Aboriginal community. Framlingham was a mission. There's a visiting GP, there's allied health services, playgroup, community lunches, Cocoa Blokes, which is a group aimed at young Aboriginal boys. It's a dancing, engaging with culture. They do a fantastic job. There's a very strong mental health team out there. They have a clinical nurse and visiting services. There's very strong community engagement, and there's a strong focus on quality improvement. They do a fantastic job of quality improvement. It's real, it's on the ground, it involves community. Everyone has access to input into the quality improvements. The Word Were Wrong Elderly Community Health Service, which is based in Portland. There's a medical clinic there with 2 GPs. They have a nurse cervical screen and immuniser. They have very strong focus around community and lunches. There's a strong women's program, which is the Well Women's and it's got children in it, but it's basically focused around disengaged women who have got kids in the community, and it's very intensive. There's a youth focus, even though it's an elderly community service, they do great youth work. They've got Leon Davis, the ex-Collingwood footballer, he's the youth worker there. He does a fantastic job with the kids. There's a really strong elders group and there's a play group. Gundi Jamara, it's located in Warrnambool. There's 3 offices across Warrnambool that are part of the ACCHO. So there's a separate medical practice. There's 3 to 4 GPs, depending on probably today there's 3, tomorrow there'll be 4, next day there'll be 2, that's how it works. There's a clinical nurse, 3 Aboriginal health practitioners, courier maternity services, family services, children's services, playgroup, etc. I think the important thing to understand is a lot of the ACCHOs are actually in a position to do holistic health. Probably more so, I've worked in mainstream services as well, more so than mainstream, because there is a wraparound service. There's a genuine ability to do holistic health because we can access family services, we can access, and if it's done well, but having said that, a lot of the work is reactive rather than proactive because we're still obviously always managing in a crisis management mode. Windamara, apparently somebody spoke yesterday about the Budj Bim UNESCO Heritage World Listing. Oh, I don't know why that's so small, but anyway, there's Hayward and Hamilton services. So they're across 2 locations. There's medical services in both. There's a very strong community engagement. Aaron Morgan, the dancer there, he just won the young in the Glenelg Shire Young Achiever Award. Up here is replica stone houses on the land. It's a really great land management team down there as well. They own a lot of land. It took a long time and a lot of work from a lot of people to buy back their Aboriginal land. And they also employ kids, young men and young women, to be rangers on the land. So they actually have an employment-based opportunity as well. There's family services, there's community dinners in both locations, women's groups, elders groups, etc. Okay, as part of my role, what was really important, because it's only been a year in place, is to develop quickly networks, stakeholders and relationships, because none of this work can be done just by us in ACCHOs. Simply can't be. We need all the help we can get. VACCHO obviously is a great supporter, and Janina, who's in the photo there, and Sarah and Amber, they provide a lot of resources and a lot of assistance. The Cancer Council have been fantastic. The Breast Screen Victoria, with the breast screen buses are coming out to all the PEIC locations in October, and that's work that's been done through advocacy from the ACCHOs. The Department of Health has been a great supporter. I work a lot with schools. I work with the Primary Health Network as well. reconciliation groups, members of those, because you have to be with like-minded thinking people, and that way you can actually resource and work collaboratively together. Collaboration is not just a word, it's about actually ringing up someone and saying, I've had somebody drop out of an event, yes, I can be there for you, Belinda, because you've established a relationship with them and they know you'd do the same for them. Oh gosh, 1 minute. Okay, so the toolbox, we use PenCat, social media, we have reception areas, International Women's Day. So some of the work we do around deadly sexy health training, webinars, we've run camps, we've done youth clinics, 3x3 basketballs. So this is the camp. We did an overnight camp for young people. So we insist to have an ACCHO health check. That there's, but the most important thing is we weave culture through everything that we do, whether it's basket weaving or how to use a boomerang or some elders yarning to tell the kids about history. We had a youth health day where we worked with the local secondary schools where we completed ACCHO health checks there and then on the day. It's important that we use really simple language. So if we're telling the kids they had to have a sexual health check, it's important that they know that means you pee in a cup. Like it just has to be really simple so that people understand it. That's the youth day that we did, and the culture that we mixed through that was, and there was great outcomes. We had the kids all got their treaty T-shirts, they got their health checks done. We did 3 sexual health checks on the day. The oldest kid there was 15, so even though there was only 3 done, there was 3 very important sexual health checks that were done that day that would never have been done otherwise. There's an art day where we do some consent-ish, talk to young girls about hygiene and consent and start the process off so they develop a trust with us so that eventually they'll come to us when they need us. We have cervical screening night. We had dinner for 95 women. There was hair, beauty and massage. But we did 13 cervical screens were completed on the night. Every woman was interviewed about their cervical screening status and so that we actually can work with them individually. Also, another cancer screening event was at the clinic. So we provide attendance at dinner, we use art, we do ACCHOs. So we're providing the culturally safe venue for the GPs who are normally in reactive mode to have preventative health. So we're doing this collaboratively. We want to use culture and connection. We use engagement and we do use incentives. So an ACCHO health check, you will get a gift certificate, like in the play last night. You will potentially receive a T-shirt. We don't use deadly choices in the southwest, but we do have locally designed T-shirts. I think the important thing is using what's there, and if it doesn't exist, create it. So there are lots of potential events that we can get involved in, whether it's Close the Gap or Reconciliation Week, and if it's community lunches and dinners, people are welcome to these events. So it's really important that collaboratively we work together. If you have an interest in Aboriginal health, introduce yourself to the health workers and have an understanding of what collaboration can do. So where next? The evaluations are important. The youth clinic that Tara was talking about is an outcome of the 2 days that we've done with the youth. They're actually involved in creating what they want for a youth clinic. 18 to 25-year-olds I've found really difficult to engage with. They're out of school, they're generally healthy, and they don't often visit doctors. So we have to make it part of a systemic approach that everyone who comes through the door, if they're having a health check or if they come in for a sore ankle, that it's part of the process. We're asking everyone today to have a health check. So there's no shame. There's also, we're doing... The GPs and the clinical teams at the ACCHOs don't often get released to events like this. It's as simple as that. They're too busy. They're booked out months in advance. We don't have enough GPs, so they don't get this education. So we need to provide it in another way. And that's what we're doing by providing a culturally safe dinner for them to attend locally. Looking at basketball and collaborating with sporting clubs.
Just acknowledge the Dja Dja Wurrung elders, past, present and emerging, and pay my respects to Aboriginal people here today. I work for Thorn Harbour Health. I'm the Aboriginal and Torres Strait Islander health educator, which used to be the Victorian AIDS Council. I guess our partners are the ACCHOs and VARS, particularly, and Anne as well. So I'm also queer, so I often say I'm inside the community because I'm Aboriginal, inside the Aboriginal community, but I'm on the outside because I'm of my queer identity, and I'm inside the queer community, but I'm actually on the outside of that because of my Aboriginal identity. So there's issues about marginalisation, and what we've been doing is trying to support. There's some great things happening in the LGBTI Aboriginal space, so watch this space. There's a network being set up, and we've just been funded by the Cabinet of Premier Department to support a network called the Koori Pride Network, so watch out for that, and it'll be sort of hopefully linked to the Pride Centre. What I try to do is make Thorn Harbour services, the mainstream services, more applicable to and more safe for the LGBTI Aboriginal community, and try to make the ACCHOs more safe for the Aboriginal LGBTI community. So we've been doing some a really successful education ATSI inclusion training that 70 people attended in Melbourne. We're hoping maybe with funding we can roll that out to the regional areas, and that's a partnership. I always work in partnership with the Elizabeth Morgan House, which is a family violence service, and the Zoe Bell Gender Collective, and you know they're both great services to refer to. We're hopefully to run that out. I work at the Positive Living Centre on a Tuesday supporting Aboriginal clients there, and I've sort of run out of time, but you can grab me. But there are some exciting things. We're a priority group now in the Aboriginal health plans, which we never were, the LGBTI Aboriginal community, in the Aboriginal health plan and the Aboriginal social emotional wellbeing plan. The sad thing is that I'm funded by MAC Cosmetics, my role. So, not sad, it's great that I get a job, but I'm just saying that we're in these plans, but the money's not rolling into the communities. It's fantastic that we've been funded for a project worker to support a network, and that we'll be recruiting for that network. We're having a primary meeting at the end of this month to sort out the way forward for a queer Aboriginal network. And so hopefully that will be a go-to position for people in the state who are looking for people with lived experience in the community as well. So I'll just leave it there. Thank you very much.